for coming today. My name's Jo Sutton, for those of you that don't know me, although I think you all do. I'm the Nursing Associate Lead for Primary Care based at the Devon Training Hub. And my role really is to support practices and individuals who want to go through the Trainee Nursing Associate programme to become registered nursing associates. The transcript's on, sorry about that. And this is a first of a series, really. We have a range of education providers across Devon who run trainee nursing associate programmes. And today we have our colleagues from Marjon to introduce their new programme to us, which has, well, I'll let you tell us all about it, but has some specific, it's targeted audience, so to speak. So Claire and Sandy, I'll hand over to you. Can I just ask, though, would you prefer questions at the end? If people want to put questions in the chat, I can pick those up at the end. But would that be okay? So if we have any questions, Caroline, I know you have to dip out in a bit. So if you've got any questions, if you put them in the chat, I'll pick that up at the end, okay? Thank you very much, Claire and Sandy. I'll hand over to you.
You know, I'm going to share my screen. I'll attempt to share my screen and show you our presentation, hopefully.
Thank you.
There we go. Okay, I'm going to do the whole. Hope everybody can see this. Okay, so thank you. Does that work?
It does. I was just going to say, there's a bit of background noise there, so perhaps if the rest of us turn off our mics whilst you're presenting, it might be better. If that.
Okay, so thank you so much for joining us today and listening to Plymouth Marjon University's presentation regarding our nursing associate provision. So my name's Claire Langman. I'm the Associate Dean for Nursing and Health Sciences and Practice-Based Learning, and I'm joined by my colleague Sandy Knowles, who is the Programme Leader for our Nursing Associate provision. So just to give you a little bit of background in terms of the university is renowned for its provision in speech and language therapy, and more so its education as well. And in 2021, we started a strategic implementation plan to bring healthcare education programmes to the university. So I spent a year going out and visiting many of the colleagues that are on call today, working out what we needed different in the region. So what was working, what wasn't, what the gaps were, what we could change. And this programme is truly a result of, I guess, a gap in the market in terms of the nursing associate. So I guess the first question is, why Marjon? So what do we bring different to Marjon to the region? Because there are a number of nursing associate programmes and there are a number of nursing associate providers within the Southwest. So we are truly a small university, big heart. That's our tagline. So we know each of our students by name rather than by number, and it's about sustaining that small number so that we can really enhance that quality and maintain that quality across the programme. We are a values-driven university, so our 4 values are humanity, ambition, curiosity and independence, and that is something that we promote throughout the entire programme and entire provision, and that we promote with you as stakeholders as well. In terms of each of those values, it means that we're really student-centred and we drive those home to our students throughout our teaching, throughout our simulation and throughout our support in practice-based learning. We are a university that is balanced with social justice and has strong social values as well. So we're very, very community focused, which is why we felt that our nursing associate programme really needed to push home around the social care and primary care provision, just to really bring that sense of community and that balance away from the acute sector. So as part of our programme, there we have a practice learning group. Now, the practice learning group really makes sure that individuals or stakeholders of our programme. It means that you're able to discuss intelligence. It means that we're able to work out what works and what doesn't work. Be able to drive forward initiatives around provision and about things that you require your individual apprentices or students to know. And we meet on a regular basis to really make sure that the curriculum stays current and is corrected or modified in any way that's required to support your understanding and what you require. We offer as a university distinct learning support. So if an individual has additional learning support needs, we are out of, I guess, the universities all provide support. I would say that's something that Marjon is absolutely outstanding at, about supporting the individual student. And we do that in conjunction with you as employers, because it's all very well universities suggesting reasonable adjustments, but it needs to make sure it works in practice for you as well, and make sure that we're not pushing the boundaries in terms of additional support that really don't make them feasible for the role. But we are very proud of our learning support process, and we do support our students to be able to access up to £19,000 a year as an apprentice, which is on par really with the Student Finance England, so the direct entry students, where they might access the disability support funding through Student Finance England. So we have a parity in process, I would say. So this can range from anything from equipment to Tier 4 mentorship, and we're really, really proud of the support and the wraparound service that we provide our students. So we are really proud of our widening participation agenda involvement. So we really, truly widen participation. And as a university, it's not tokenistic. We really do support levelling up, and so we don't always look for those traditional entry criteria, and that entry criteria is agreed in conjunction with our employers. And we have a Getting Ahead bridging programme to support those non-traditional entry routes. So it's an 8-week programme which we offer for free. So if your student or your apprentice decides to stay with us, it is free. Other than that, it is £250, and it is a really successful programme. And it's about lifting those traditional students from a level, perhaps they only have a level 2, and we work with them for 8 weeks to lift them up to a level 4. And the success stories associated with this are phenomenal, and we've seen some absolutely amazing trajectories into other programs, which include nursing and in nursing associate, but also across the allied health professions as well. So we are quite unique in that we have clinical facilitators. So we have our own clinical facilitators, which can come out into practice to support you and your apprentice. It means that sometimes we can take off the pressure of that learning environment, and it's something that we've considered for a long period of time, and essentially it's a really enhances that student journey and really enhances your ability to support a student as well. So they are individuals from bespoke areas of speciality, so they can really come in and make a difference to both yourself and the apprentice. We have designated apprenticeship coaches as well, who come out and support through the apprenticeship process, and then a designated support as well, so supporting in terms of funding streams such as co-invest, where the levy pot doesn't exist as well. We also have our tripartite reviews, which Sandy will pick up in a second, but it's really around making sure that we have that open collaborative relationship between developing the future workforce between the student, the university and practice. And again, those apprenticeship coaches and those clinical facilitators really support that pastoral and that wraparound, as well as making sure that there's clear communication between practice and university. Specifically for this route of the programme, it's about making sure our terminology is correct. So it's about taking out the word patient, because obviously we know in social care that it's around residents, it's around families, and it's around individuals. And we know from the information we picked up through those stakeholder initiation and implementation stages of the plan here at Marjon, that sometimes it's around those students feeling included, because it's removing the terminology and all the emphasis on acute language and terminology, and really driving it home around primary and social care, and that's embedded across the programme. The other benefit that we have here at Marjon then is our simulation suite. So our simulation suite is outstanding in terms of the fact that we have an acute side with an intensive care, but the most exciting part is we also have a community setup. So we have a full GP surgery. We also have a residential home with a day room. We have 2 assisted living bathrooms, and we also have a mock flat as well. All this is supported with something called Sim Capture, which is a video system, which means that we can record the student student in simulation. It means that you can then dial in and see what we're talking about, and you can conjointly reflect with the student on what went well and what didn't, and work with that and utilize that to develop practice. The other bonus that we have with our simulation is that we want that to be your simulation space as well. So it's a really open mechanism, and we want the campus to be this beautiful transition between practice and the learning environment. So if there's something that you want to do, you might want to design a simulation, or you might want to run a training session for your staff. The space is yours to open, and there's no charge for that. We just need to know what you need and when you need it, and if you need any support. And so we really want to make sure that it's an inclusive environment and there's that transition space between both environments. And the other part is around our resources. So you have open access to our student online learning environment, which some universities don't allow, but we allow that, so you can really drive home and see what the student is learning. And sometimes that really supports them in practice so that you know what they're undertaking. We also have a designated practice assessor and supervisor hub where you can access all of the information around the training packages, and which are free to support your student. But also there's a forum within there, so it's about creating almost an additional community within that secure space where there are only practice assessors and supervisors to, if you've got any questions or you're struggling with something, and it is monitored, and it's that wraparound space to enable you to feel really, really supported. And then just before I hand you over to Sandy, so we have our people who use services group. So we've introduced them at a high level, and they're basically allows us to formalise the process in terms of how we engage them in our programmes. So our people who use services group are actively involved at the moment in terms of admissions and interviewing. They're involved in our simulation and our assessments. And the most important part is they're involved in debriefing if there's a placement rotation or a spoke placement for those apprentices, or even just that contact point through mentorship. So it's really another alternative apart from our clinical facilitators and the programme team and yourselves. It's just an additional person that they can speak to about their experiences, and really get what it feels like from an expert by experience. They also provide real life teaching case studies. They can support us in our research, but they're also active members of our practice learning group, who you'd meet as part of that session, and they're a great advocate in terms of programme design and assessment design, and really making sure that it's basically fit for purpose. So I'll hand you over to Sandy now, who will talk about our admissions.
Thank you very much, Claire. Claire's already mentioned about widening participation. That is something that we do feel very strongly about. So the whole process is one of joint recruitment. There's a series of stations and activities that the prospective applicant undertakes, and then also an interview process as well. And also local employers are involved with that. So you're very welcome at any time to join us on our recruitment day. So it's a whole day where we invite students to come in and provide a nice lunch, etc. And then our whole team are also involved within the recruitment process. So obviously this is a Nursing and Midwifery Council approved programme, so therefore it is subject to the NMC code. So applicants must be in good health and of good character. They need to have a GCSE grade 4 or level 2 in English and maths. So that's non-negotiable. Everyone needs to have that. They also have the ability to develop their literacy, numeracy and IT skills, and they may or may not have a level 3 qualification, and we'll come on to that a little bit later. We can also consider relevant clinical experience. So because of the NMC requirements, obviously apprenticeships will need to complete a self-declaration with an enhanced DBS enclosure. Okay, Claire, thank you. Thank you. So also just to say, in terms of fitness to practice and sustainability, so on entry to the programme, all of the students will need to declare their fitness. This also applies on exit of the programme as well. The fitness to practice process fits in with the Plymouth Marjon University policies. If there are any occurrences, then it would need to be continued through to the end, even if the student is withdrawn from the programme. So fitness to practice could be in response to either a declaration at the beginning of the programme or during the programme, where the information will need to be reviewed just to make sure that obviously the student is okay and whether it's appropriate for them to continue with the programme. So it might be, or it could be concerns raised by academic staff, or it could be related to an incident in practice or in response to a member of the public. So as Claire has already mentioned, Marjon are particularly good at supporting students. And so the students will all have an initial induction, and that includes being introduced to our library service, support services, IT support, policies and procedures. So we do have a very good range of textbooks and academic journals now to support nursing programmes. Students will also have an induction into the programme, obviously to the Nursing Associate programme, and also the School of Health and Wellbeing, which is where our department sits, and also develop an understanding of professional responsibilities and any mandatory training. So obviously on an apprenticeship that is shared with the employer. Students will also undertake an induction session at the commencement of each practice placement, and that is undertaken by our practice learning partner or by yourself as employers. Okay, thank you, Claire. One of the other things that we're very committed to at Marjon is around student empowerment. So we want to make sure that the students do have full access to all of the support which is available to them. Obviously, we want them to be successful students, so we want to do everything we can to support that. Where reasonable adjustments are required, we will do our best to work with them. And there is also a focus on interprofessional learning across the school. As Claire mentioned, we do already have provision for speech and language, physiotherapy, and there are a range of other programmes currently under development. So the students will be exposed to that learning environment, which they're seeing in practice all the time anyway. So one of the reasons why we have the Nursing Associate role, I'm sure most of you know here that the Nursing Associate role was introduced in 2017 in response to several high-profile reports at the time around patient safety. And then in January 2019, the NMC became the regulator for the Nursing Associate role. And I think today we've got something like 7,000 nursing associates on the NMC register. So the original idea was that we needed to bridge the gap between healthcare support workers and registered nurses, but also that it could become a route into nursing for what we would call non-traditional students. So it was opening up another pathway to bring more people into the profession. So we've talked about the entry requirements. If a student only have the level 2 qualification, so provided they have their maths and English level 2, and they might have a BTEC level 2 in health and social care or something, they may not have a level 3. That's fine. If they come on to our bridging programme, which is a level 4 programme, and successfully pass that, then that would be accepted as an entry requirement onto the Nursing Associate programme at Marjon. It is a superb programme. I do have experience in my previous role as a programme lead of having students who've completed this programme, and they were the best prepared students that I ever had on the programme. So I feel really committed to it because I know it's an excellent programme and it really is good preparation. So in terms of progression, once the nursing associates have qualified, then they can register with the NMC and become registered nursing associates. They are also eligible at that point as well to be able to progress on to future study. So because the nursing associate role is generic, then they have an opportunity And certainly we've designed the programmes at Marjon for students to be able to step onto BSc nursing programmes. These are currently under development across the fields of nursing, and we are also looking at developing specialist pathways in the final year of the BSc degree programme, which will include pathways such as primary care, or GP nursing, or community nursing, or social care nursing. So we want that whole final year to be a real focus on a specialist area, so that people are very well qualified at the end of it. Also, again, once they've completed their BSc studies, it is possible to go on to a range of other qualifications. So obviously, if you have a BSc in nursing, it's possible to go on and do an MSc in advanced clinical practice, or you may want to go on and do an nurse postgraduate qualification in order to obtain another register. So, and again, these are currently under development at the moment. So there are lots of options once students have completed the initial 2-year nursing associate foundation degree, and it absolutely does offer progression into the wider workforce with many opportunities. Thank you, Claire. So just a quick overview of the nursing associate role. It's a new profession, not so new now. NAs are accountable for their practice. They are members of the nursing team, and as we've said, they are there to bridge the gap between health and social care assistants and registered nurses. It's a generic role, so that means that nursing associates support registered nurses across all the fields of nursing, and look after people across the lifespan. And that can be anywhere. That can be in people's homes, in the community, in hospital, supported living, across any of those environments. Thank you, Claire. So as Claire's already mentioned, the programme has been developed as part of our collaborative journey and really looking at our rationale for development. So it has been completed in consultation with local employers. We are very aware of the difficulties within the workforce across sectors and region. So in response to that, we have developed the Nursing Associate Programme. There are 3 potential routes of entry. So there's the direct entry full-time route over 2 years, and I think we've recruited 15 students for September for that programme. There's also a direct entry route part-time over 4 years, and then we have the high level apprenticeship route, which is full-time over 2 years. The underpinning ethos of the programme is really to develop critical thinkers with comprehensive problem-solving skills. So they have their clinical knowledge, practical skills and professional behaviours, so that they are really ready to hit the ground running when they're qualified, and also having a real awareness around the impact of deprivation, social determinants of health, etc. So helping them to become very aware of their healthcare environments. Thank you, Claire. So as you know, our campus is located centrally to the Plymouth Integrated Partnership. It does form part of the wider integrated care system across Devon. So it serves a population of 1.2 million people. And we know from digital data in December 21 that there were 7.9% vacancies across the region, or 2,600 plus registered nurse vacancies. We're also aware that in the health and social care sector, there were something like 17,500 unfilled vacancies. So there is enormous need across our own region. Thank you, Claire. So with that in mind, this is one of the reasons why we're very keen on local recruitment and also widening the participation. So we want to support and recruit learners both from traditional and non-traditional education backgrounds. So across our region, there are 104 secondary schools. So we will be looking to recruit younger people into the workforce from there, but also mature learners with life experience. And that's why our entry requirements are very flexible at the moment. We've already talked about, if you do have prospective students who do not come from traditional backgrounds, who don't have their level 3, etc., then there is an opportunity for them to complete the Getting Ahead programme, which Claire has told you about. Thank you, Claire. So we've already talked a little bit around recruitment admissions. Obviously, just to say, it is a joint selection process, values in accordance with the code. And also just to say, if a student or an applicant where it doesn't speak English as a first language, if they don't have a level 2 qualification, then they would need to sit an IELTS exam. It would be easier to get the level 2 qualification, if I'm honest, because that's a very high level that is required from the NMC. Thank you, Claire. So we've already talked about the requirements that students need. Thank you, Claire. We are also very happy to recognise prior learning. So as most of you will know, you can only have recognition for up to 50% on any nursing midwifery programme. So essentially that would mean we could recognise, for example, year 1 of the programme and have a student come in and start at year 2. So that could be someone who's completed maybe nursing studies elsewhere, and they may have completed nursing associate studies or some other qualifications which we could look at. Thank you, Claire. We've already talked about the bridging programme. Also, just to say that literacy, numeracy, digital and technology skills are also integrated across the programme. As you'll probably know, on any apprenticeship, there has to be a focus on literacy and numeracy. And surprisingly, many students that come onto these level programmes have quite poor digital and technology skills. So again, that's something that we've integrated across the programme. So we do have tutorials on study days which last for 45 minutes. So they will be very much geared towards reviewing numeracy skills for drug calculations, etc., that kind of thing. So we are aware that people need help within this area. Thank you, Claire. Some of the distinctive features of our programme, Claire's already mentioned our clinical simulation, and that is something that across all of our programmes will be present. So, for example, it could be that the students are in the classroom in the morning learning the theory, and then in the afternoon they'll be in clinical simulation. They will be applying that. I think it's a fantastic way for our students to learn. The other thing that we will also be including is what we call accelerated learning days. So it's similar to a conference day around a particular topic. So for example, it could be tissue viability. So we would be inviting experts from practice to come in, and the whole day would be learning and activities around that particular area, which would apply to many students across different areas. So again, these are distinctive features in addition to normal teaching and learning, but actually really helping the students to apply the new knowledge and also to learn from experts actually in practice. So things around mental health, child health, learning disability, neurodiversity, autism, etc. So some areas that we probably need to know much more about to enhance our practice and improve patient safety. So we're really excited about this provision. Thank you, Claire. We've already talked about interprofessional learning, so again there will be opportunities for interprofessional learning within simulation, and as Claire mentioned, we do have acute simulation areas, so that's suitable for obviously students coming from the acute sector, but also we do have areas for community nursing, GP practice. I can't remember if Claire said we have a GP practice setting, and any other setting really. So we really are able to develop our simulations to meet everyone's needs. Interestingly enough, I mean, we've got a current program in progress, which is the assistant practitioner program. So again, we have students from both acute and community sector, and I've been gathering some data around the kind of activities and simulations that practice want. And what's really interesting is that there are themes which are coming across. The biggest one is communication. So in practice, people are concerned about their students being able to communicate effectively, also being able to respond to patient queries. So lots of work required around mobility, for example, supporting OTs, physiotherapists. So it's really interesting that that we're beginning to develop that intelligence now around the kinds of things that we need to be looking at. So I know Claire mentioned earlier, and we absolutely mean that, you know, we want to know what you need your nursing associates to be able to do on qualification. So we want to be able to work towards that. So just to show you the programme structure, so there are 5 modules in year 1 and there are 5 modules in year 2. So their practice module runs all year. That's a 40 credit module. And then there are 4 20 credit modules. So essentially, the practice modules, when they're out there in clinical practice, there are 4 study days attached to that. So 2 study days at the beginning of each year, at the beginning of year 1, and 2 study days consolidation at the end. And then all of the other modules run over 8 weeks. So they're modular, so it's one module which starts, finishes, and then you move on to the next module. That model is applied in year 2. And also just to say that the modules which the students can use for recognition for prior learning will be promoting health and preventing ill health, so public health essentially, meds management and research, and the whole of year 1. So that means that if students are studied with us, then they would be eligible to go into a BSc nursing programme with us. Thank you, Claire. So that's just to show you what the programme structure looks like, and you'll see it's each module, as I said, is delivered separately, and there are some non-university weeks included within that across the academic year. Thank you, Claire. Should we just go through to the high level apprenticeship for the moment, because I think we probably don't have anyone interested in. Okay, if you can keep going, thank you. Brilliant, thank you. So practice learning for the high level apprenticeship it's 1,150 hours over 2 years. That includes external placements of 460 hours over 2 years, or 230 hours per year. And then for the remainder of the time, there is protected learning time, which is 690 hours over 2 years, or 345 hours per year. So that is the NMC requirement for external placements, and which should also incorporate the apprenticeship requirements of minimal study at the same time. Thank you, Claire. So in terms of placements with apprenticeships, obviously these will be jointly managed with the university and also the employer. I think we're all aware that there are major issues in practice around placement provision, etc. So I think it's really about being flexible and really looking at what it is that we want our students to learn, and then finding places to be able to support that. Just to say that we will have an electronic e-pad for the nursing associates in September, delivered through the ARC platform. So this has been under development for a while. Claire's spent a lot of time with the ARC team, and we're about to go live with the EPAD on ARC with our assistant practitioners in the next couple of weeks. So we'll be trialing that just to make sure that it's working. It will record hours, and Claire's also spent a lot of time with them to be able to record the apprenticeship hours as well. So for any of you experienced with NMC plus apprenticeship hours, etc., they can be extremely challenging, but we're hoping that we've come up with a way to be able to do that really effectively.
I was going to say, Sandy, I think it's quite pivotal in the fact that there are multiple platforms. We're using the ARC platform to integrate the apprenticeship requirements. So it just means that you just got to log in just once, which is fantastic on one platform.
Yes, it really is. Yeah. Thank you, Claire. So you'll all be familiar with the hub and spoke model. So obviously all of our apprentices are in base placement, so they're all employed and supporting staff where they are when they're on the programme. And I think it is about looking at using hub and spoke models so that your students are actually gaining the experience that they need to be able to support practice within your area. So there are certain things that you will know that you need your students to know. So I think it is about actually working collaboratively and looking at that, coming up with a pathway for each student, and then working together to be able to provide that experience. Thank you, Claire. Claire's already talked about some of our support in practice. Obviously, because it's an NMC programme, the students are subject to NMC standards for student supervision and assessment, which means allocation of a practice supervisor, practice assessor and an academic assessor. Also, the nursing associates have their own set of standards that are defined by the Nursing Midwifery Council. Obviously, our education programme is also subject to the education standards of the NMC, and we're also governed by the code. So the students will develop knowledge around that once they're on the programme, but those are the structures which support students in practice. Thank you, Claire. So those of you familiar with the student supervision and assessment, the TNAs have practice supervisors. They can be a range of healthcare professionals, nurses, nursing associates, and others to be able to support their learning. Thank you, Claire. All nursing associates have a practice assessor. Now that does need to be a registered nurse or a nursing associate, and they're the ones who complete the formal assessments with the students. So their episodes of care and also their meds management assessments. They're also the ones that sign them off for professional values and also complete their end of year 1 and end of year 2 ongoing achievement record document. And that's with the academic assessor. Thank you, Claire. So the academic assessor is a member of the university programme team who is also a registered nurse, could potentially be a nursing associate, and we liaise with the practice assessor in practice, and we are the point of contact if there are any issues or any concerns that are expressed at all. Thank you, Claire. Claire's already mentioned that we will have clinical facilitators. Not sure if the ad's actually gone out yet. If it hasn't, it will be. So these are members of the PMU team, and they will go out and work in clinical areas under honorary contracts, and they will be able to support learning. And the reason why we've introduced that is because we are very aware of the pressures within practice on teams. So it's a way for us to be able to support that process, looking at developing learning resources, etc., to be able to meet those needs. Thank you, Claire. We'll also have an apprenticeship coach, and they will be the ones who complete the tripartite reviews, which are an auditable requirement in any apprenticeship programme, and they'll happen every 8 to 12 weeks. And we will try and arrange those as far in advance as we possibly can. And again, so that's between the apprentice, their practice supervisor or practice assessor, and the academic assessor. Thank you, Claire. So we talked about the tripartite reviews. Thank you. Claire's already talked a little bit about the practice-based learning assessment and supervision hub. So we do currently have a web site under construction for employers and students to be able to access information and to be able to provide support, so it's accessible 24/7. But also, as Claire said, the platform that we use for teaching at Marjon is called Canvas, which means that people external to the organisation can also access that. So the employer would have access to the module and the learning materials that the student has access to at that point in time. So, which is fantastic, and that's quite unusual to be able to provide that. So we're really excited about that. And again, we're already doing that with the assistant practitioner programme. It's working really, really well. So we've got, for example, employers in the emergency department who are supporting the students with activities that match what we're actually teaching at the moment at the university. So it's working really, really well. Thank you, Claire. Claire's already talked about the practice learning group, so meeting regularly, and that is something that we really want to be able to establish, because you know, these are the times that we can talk about what's actually going on in practice, what's working, what we can do to improve things, looking at development packages, learning outcomes, and developing a bank of resources to be able to share and, you know, to support everyone. Thank you, Claire. So the student assessment document, so a practice assessment document, as we've said, via the ARC platform. Also, there are reflections which will be recorded within that, and they will also have an ongoing achievement record, which is signed off by the practice assessor and the academic assessor at the end of each year and prior to going on to the register if successful. Thank you, Claire. This is the usual support for any student on an NMC programme. So prior to the placement, obviously gathering some information. And again, I think it's really important around the practice group, learning group, to be able to develop those resources. If you are supporting a student from another practice, or, you know, from a care home, for example, who's coming to your area, that they do have some information about what to expect, what that looks like, what the learning outcomes will be, what they can, you know, learn, etc., and vice versa. They will also have a placement orientation, so that's finding out things like where the emergency exits are, what you do if there's a fire or cardiac arrest, or, you know, all of those usual things. An initial interview with the practice assessor, so really taking stock of where the student has come from, what they've achieved so far, where they're at in their level of training, what they're hoping to achieve whilst they're in your practice, what can they realistically achieve. Then having the midpoint interview, so are they on track? Have they achieved the learning outcomes? Are they at the level that you would expect them to be at? Do they need additional help or support? And then their final interview with the practice assessor. So how have they done at the end of that placement or period of time? Are they ready to progress? Are they ready to be able to move on into year 2, for example, or are they ready and have they met all the requirements to go onto the register? So that's the and that's the same for undergraduate student nurses as well. Thank you, Claire. That's just some general information around the Plymouth Marjon. So it's gone up 39 places in 5 years, which is pretty impressive. It's number 5 in England for teaching and quality. Number 5 for Student Life, University of the Year. Number 5 in England for lectures and teaching quality. So just to put that into some perspective, there are, if you look on any good university guide, there's usually about 140 different universities which are listed. So to be number 5 at anything is really quite an enormous achievement. So in terms of student satisfaction, Plymouth Marjon rated as the number 1 in England, also first in England for social inclusion, number 3 in England for learning community, number 3 in England for student voice, and also number 3 in England for student support. So these are pretty impressive, percentages that we have been able to achieve. And I think that really does reflect the support at Marjon.
And there we go. Thank you very much.
Thank you, Claire.
That's great. Thank you very much for that great overview there. I've got a few questions written down, but I'll open up to everybody else first of all. Has anybody got any specific questions for Sandy and Claire? No, so feel free. So a few people are typing, so I'll let them carry on typing, and I'll ask a couple if I may, and I'll also try and pick up, Nikki, your point there. Can I ask, and you knew I'd ask this one, a little bit more detail around placements, and you will know that some other universities delegate the responsibility for placements to practices and nursing homes, and that's not always an easy process for small practices, large practices even. And you talk about this joint approach, which is great. It's just to unpick that a little bit more, and what does that exactly mean? If I'm a practice manager, for example, or a lead nurse, and I've got someone in my practice coming on your program, what would be my responsibility within that?
So we can lead on the entire process. So we have an extensive placement team onboarding. So we have a compliance, someone that will obviously lead with the audit and make sure that everything is correct as well as it should be. And we also then have our lead placement coordinator, who will be responsible for rotating students through the requirement, and they'll obviously monitor the hours and be the communication point. And then we have administrators to support as well, so that it really takes the burden out of practice, so we can do as much or as little as is required. But obviously, and that can be individual to the individual practice or the individual residential home as well.
Yeah, that's brilliant, and I think that's quite probably reassuring to hear. Just to add to that, though, my guess is that perhaps if I had my TNA, so there might be some reciprocal element of that. So I might be included in that cycle if my practice might need to take a student from somewhere else.
Absolutely. Yeah, no, I'd agree, Jo. It's around, I think, that reciprocation, and it's about, obviously, when that student's not with you, you're going to get a student back to support. And although they might not have the same, obviously, knowledge and skills associated with that organisation or that practice, they will have the skills because they're front loaded through practice, through our simulated practice as well. Right. So it's definitely about bridging that skills gap in between. But being part of that reciprocation agreement is fantastic, and it's a great way of that pollination. So
that's great. Thank you.
I'm sure some of that will continue as well, because as you know, there are thousands of students to place across the regions, and we know that there is huge pressure on places. And also, just to say, where the organisations do manage those placement processes, they are paid to do that, aren't they? They receive a fee to be able to manage those processes, which obviously this will sit with the university here, so that there wouldn't be the allocation of that fee. So, but I still think that there will need to be some reciprocal practice. But I think it would be really good to do a piece of work, because I think that we need to sit down together and really understand what kind of experiences do we need these students to have. Now, we know that they have to have 460 hours in external placements. If you're in a care home setting or in social care, because the way that the standards for nursing associates are being written, the students do need to obtain experience within acute nursing, and they do need to obtain experience within community nursing, because their role is to support registered nurses across all the fields of nursing. So that's the definition of their role. So that experience does need to be obtained, but that's not to say there might be other experience as well that you want your students to develop expertise in, that you think is really relevant. You might want them to go and spend time, I don't know, could be with a GP practice, or any other service. So I think it really is about looking at what is going to make your students the best, and help them to be where you need them to be.
Yeah.
I think that's a real challenge.
Yeah, thank you for that, Sandy. I'm aware we've only got 5 minutes left. So Joe's asked, do we have to work a specific amount of hours?
For an apprenticeship, yes. So minimum is 30 hours a week. That is the requirement. Yeah.
Okay, thank you. Can I ask when your closing date is for your September intake?
So I'll say we've got some interview rounds. The last of the interview rounds will be July the 20th, which allows us to process ready for the September, just because the university, there's quite a lot of closure within admissions and things like that.
Sure, that's great. Thank you for that. Just one other question: functional skills, need to have functional skills before you start?
Yes.
Yep.
Yeah.
And Nikki, do you want to ask your question about dom and residential homes?
Yeah, I'm just trying to find out what it was exactly.
It was about the clinical facilitators.
It's about the clinical facilitators, yeah. So one of our big areas is struggling to get TNAs both in dom care and in residential care without nursing. I'm sure that you're absolutely familiar with the reasons why, and it's but we're actually getting more dom care providers and more residential homes coming to us now and saying, we want to be part of this, but we haven't quite worked out why. Will the clinical facilitators help that?
Well, they can, but to a point, yes, they will be able to. So I think in terms of any discussions moving forward about what you think that may look like in dom care or in residential, obviously, because they're students on an NMC programme, they do have to work under the supervision of registered nurses or nursing associate registrants. So we have to be mindful of that. So certainly, if a clinical facilitator from the uni, if they're a nurse or a nursing associate, then that absolutely counts, and that they're able to do that. So it's about looking at how do we meet the NMC requirements and keep patients and students safe, during that process.
Yeah.
And I know we were having conversations with someone from dom care recently around having which I think would work really well, having like a peripatetic role, someone who's actually there to support within that, which I think could be a collective by different employers, where I don't know, if you just had even like 3 practitioners or something, but who you could spread across your areas, who could regularly go out and support, the students and the staff, etc. And again, I think it is, for me, I think we have to find a way around this issue.
Yeah, definitely.
Because I don't see that we have any choice about that. So we just need to find a way together. And I think the conference that we're having on the 30th actually is that's what this conference is really about. We know there are huge issues out there, but we want to be able to find a way forward, because that's what we need to do together. So and I didn't have all of your contact details, so I will send the invite on to you. It would be great to have your input there to see how we can, what do we need to do? What do we need to make happen? Because this has been an ongoing problem for many years now.
Yeah.
Particularly around this role. And
yeah.
I think it would be fab if we could work together and just really crack it, once and for all, and come up with a model and maybe to support that, and look at how we can make that work, because we have to move forward with it. We've got to find a way.
Definitely, and it would be great if Jenny and I could meet up with you and Claire going forward. We're absolutely acutely aware that, you know, there's an awful lot of work that needs to be done around both areas. I mean, we've hopefully, or we're looking at having a student who works in res care, but the setting has talked about pairing up with a nursing home, but how feasible that is, we don't know. There's obviously a lot of ifs, buts and maybes around this, but, you know, I think if it's going to be successful, then we all have to come together around the table. You know, it's not just a case of the dom care providers saying this is what we want. You know, we can only do this in partnership with you and with them and everything else.
And that's also one of the reasons why we want to look at a pathway for social care, because again, we want registered nurses who are coming out, if their final year of their program is being specifically around social care, you know, we know in the future that they'll be able to support programs like nursing associates, you know, undergrad students being out there in practice. So I think, you know, we're in it for the long haul, and you know, we'd be really up for having those meetings and those discussions, and
Brilliant.
You know, and as I said, you know, trying to enlist Health Education England to support that, and coming up with a model that is a workable model that makes it possible.
Definitely. And if we're looking at the longevity of it, actually the main stumbling block is just getting the first ones in there. Because going after that, they will be able to lead. And
absolutely, and that's, I think that's why a pathway would work particularly well. You know, even if we just had 10 RNs who were coming out, you know, but with a specialist social care pathway, we immediately know then we've got places we can send people to learn about social care, you know. So we're really up for that. It's
thank
so
you.
Let's have those meetings.
Thank you for that, Sandy. And I can share the invite I've had with anybody here today, if Sandy's happy for me to do that, if they're interested in that conference day that Sandy's talking about, to talk through more of those points that you've talked. But I am very aware that we are now at 1 o'clock. Thank you, Sandy and Claire, for sharing your programme with us. Thank you for those of you that have come today. Thanks for answering those questions, Claire, in the chat. So Tanya, I hope that answers your questions. And would you mind sharing your presentation with us? Because again, I can put that on the website, because there will be others that I'm sure will be interested. But thank you all very much for your time today, and see you all again soon. Thanks very much.
Thank you.
Bye-bye now.
Bye.
Bye.
Bye.